Hello everyone, I am Dr. Shakuntla Shukla, Director of Aastha Medical Center, Lajpat, Nagar. I am practicing obstetrician and gynecologist for last 35 years. Today I want to talk about pregnancy scans. Pregnancy is a very joyful state of life for every woman. In fact, almost every girl imagines this phase of life. So the moment girl misses her periods, she thinks she is pregnant, she gets a pregnancy test and it comes positive. The next question will be, how about doing the scan? And she comes to the doctor with the hope that the doctor is going to do the scan and tell me about the baby. Yes, we do scan, but these scans are divided into 3 to 4 types of scans. First of all, we do viability scan. This scan is done between 6 to 7 weeks. At the age of 6 weeks, that is 1.5 months of pregnancy, we can see the cardiac activity, we call it heartbeat. And almost all the patients don't know, they want to hear the heartbeat. So this is called a viability scan. When you tell the patient, yes, pregnancy is there and you can hear the heartbeat and this is a viable pregnancy. So this is the confirmation of pregnancy and this is called a viability scan. After that, we just give her advice about how to eat, about the change in her lifestyle, and few more instructions to the couple. And then we call them again between 11 to 13 weeks. We call it anomaly scan, or we call it NT-NB scan. This scan is done, this is a basic scan which excludes Down syndrome. Down syndrome is an anomaly, is a congenital defect actually when the baby is born mentally abnormal. See, these children are they are viable with life, but they are not normal children, and they are special children. They need special attention. Nobody wants to have a Down syndrome baby, and most of the public knows about the Down syndrome. So we have to exclude this Down syndrome anomaly at a very early scan between 11 to 13 weeks. There are few features we see in a baby's ultrasound, and then we can put a doubt, the scanner puts a doubt whether this baby is going to be a Down syndrome baby, is going to be a normal baby. Of course, this scan is confirmed by some blood tests. We call them biochemical markers. So this I've spoken about 2 scans, viability scan and NT-NB scan, or level 1 scan. Then we go to level 2 scan. Level 2 scan is a very detailed scan where we just count baby's bones. We look for detailed anomalies. We see the heart chambers, we see the bones, we see kidneys, stomach, and it's a very detailed scan. And then this is called a level 2 scan. After level 2 scan, patient goes, it's almost confirmed that the baby is normal. Then we come to, we have started doing another scan at 24 to 26 weeks just to evaluate the heart of the baby. We call it cardiac echo. Then there is a cardiac scan done between 24 to 26 weeks of pregnancy. This evaluates the more detailed study of heart, where we evaluate the cardiac functions, their chambers, their valvular defects, and this scan is also being done for most of the cases. Generally we do it in a very high risk pregnancy, elderly lady, and where there is a history of heart problem in the siblings. After completing this 26 weeks scan, the baby, in between we can do fetal well-being scan. We call it FWB scans, fetal well-being. They are done in between when there is a doubt about the baby's growth, or there is a doubt about the fluid in which baby is growing, or there is any doubt we have about the development of the child. After this we go to the final scan. We do it at 34 weeks. We call it a fetal Doppler. Fetal Doppler tells us about the blood flow to the baby, whether baby is getting adequate flow for the growth, and then this scan decides about the delivery time also. Sometimes this fetal Doppler tells us that the baby is not very comfortable inside and we may deliver the baby. So this is the last scan, the 34 weeks. If all is well, then we plan delivery after 36. Actually, we want to go to 38 weeks, and if everything is fine, then 38 weeks we deliver the baby. So there are 4 to 5 types of scan we have done, and these scans give us lot of information. In fact, nowadays we can see the 3D photo, 4D photos of the baby also. The 5D scans are also available. Well, we can see the movements also. So there's been a lot of advancement in scan, and we have started showing them the photograph of the baby. This was the most of the girls are excited in seeing the photograph of the baby. So this is the development in the medical science which has brought us to this level when we can see the baby before the baby is born. So this was all about the scans. So wish you all the best for your motherhood journey, and hoping you to see whenever required. Our center is there with a very advanced ultrasound machine, and you can look forward to see us anytime. Most welcome.